Welcome, everyone, and thank you for your participation at this conference commemorating the 15th anniversary of the Tallinn Charter. I think I'm one of the few that was actually here in 2008 at that conference. Well, as you know, the Charter was adopted way back then, 2008, by all of the WHO European region member states. And there, your predecessors reiterated their commitment to universal health coverage and expressed the shared values of solidarity, equity, and participation. As you heard in the opening session, while these commitments and values are enduring, the context in which we are working to achieve and reflect them has changed, and we now face new challenges. We need to direct our focus towards promoting trust and transformation if we are to meet these challenges. Well, this conference could not come at a better time. It gives us an opportunity to reflect on what has been learned since the signing of the Tallinn Charter. And of course, we have many, many lessons to learn from recent crises, including the COVID-19 pandemic. So therefore, it's with great pleasure that I introduce the first plenary of the conference. In it, my colleagues and I hope to convey to you the contribution of trust to the strengthening and transformation of health systems. And here, I hope that you have all had a chance to read the policy brief that we produced, which gives you, I hope, a comprehensive overview of the complex literature on trust. Now, we've already heard how trust is foundational to the functioning of health systems. It is integral to meaningful and beneficial relationships between patients and their clinicians, and more broadly, between the public and their health system. Trust is key to building health systems that foster public participation and legitimacy, and these are essential for better health outcomes. But as you've also heard, the concept of trust is complex. It varies with context. And there is no single universally recognized definition. Yet, as we all know, it is critical for the integrity of health systems. And as one leading scholar on trust said, to say we trust you means we believe you have the right intentions towards us and that you are competent to do what we trust you to do. So trust is not something that we can take for granted. It isn't inevitable that the health profession or the health system will command public trust, and nor should they be seen as inherently trustworthy. Trust is precious and takes time and effort to build. Building trust involves acknowledging people's collective experiences, past and present, and particularly the experiences of those who have been marginalized and mistreated by the health system and who have suffered from those who are delivering public services more generally. Now, one of the problems we face, and we saw it during the pandemic, is that it can take years to build trust, but then it can be eroded in a matter of minutes or even seconds in the digitally connected world in which we live. In preparing for this, we found a Dutch proverb that captures this well. Trust arrives on a tortoise and leaves on a horse. But we can't look at the health system in isolation. The way that people see their health system is influenced by how they see their governments and those who implement their policies. So we in the health system, there's only so much that we can do, especially where our political leaders have acted in ways that have lost public trust. But we still have to do what we can. We need to work tirelessly to build and maintain trust. But we must also ensure that the health system is trustworthy. We need to face it. Sometimes people are justified to mistrust their health system. And when they are, we need to expose systems that are unsafe or discriminatory or lack effective governance or adequate resources. We have a responsibility to do that. And trust is dynamic. We must work tirelessly to build and maintain trust. But if we're to do that, we need to find ways to measure it. We need to see its measurement as a core element of monitoring the functioning and the quality of health systems. And we need to place it at the center of health policy making. So in this way, trust is inseparable from the idea of health system transformation. A health system that fosters trust among the public and political leaders must show that it can adapt. It must demonstrate that it can respond to the changing needs of patients while anticipating the challenges posed by unfolding crises and novel threats. So effective transformation is core to maintaining trust, that a health system will be there when needed and will be able to provide quality and equitable care now and into the future. And a transformation, by the nature of the name, involves change. Nobody likes change. It involves risks and disruption. But it also needs a vision in which everyone can trust, a vision that people believe in, a vision that people can see has the primary aim of protecting and promoting the public's interest. So successful transformation, which we all agree is needed, is only possible with trust. And trust can only be earned by involving and listening to those who are being asked to give their trust. Without trust, we cannot transform in a positive way. And without transformation that benefits all, we cannot garner trust or remain trustworthy. But trust is not something we can see or touch. It cannot be quantified in the same way as other elements of the health system, like levels of funding or numbers of health workers. It therefore pushes the boundaries of how we measure and monitor health systems and their functioning. We have much to do, and we will hear much about what we can do to find better ways of monitoring levels of trust, to identify measures that can build and protect trust. This will require investment and imagination, but it cannot be a challenge that we shy away from. Now, the evidence we have already, which is set out in our policy brief, tells us that we should be concerned. In some cases, the public is losing trust in their health system's ability to meet their needs and provide safe care. Health workers are losing trust in the ability of the health system to enable them to meet their aspirations, to realize their potential, and often simply to treat people with respect and to allow those health workers to deliver the care that they know their patients need. And the third element we talk about in the brief is that policymakers are losing trust that health systems can transform and use public funds effectively in a world that has become ever more complex. Now, finally, I want to return to the Tallinn Charter, whose signing we are commemorating in this conference. We can see that the word trust did not appear even once in the original text, and this is symbolic of how we have taken it for granted for far too long. Yet when we read the text more closely, we can see that the idea of trust is implicitly woven throughout the Charter and the values and commitments that it enshrines. We see this in how it promotes shared values of solidarity, equity, and participation. It calls for transparency and accountability, and it advocates work to ensure that we engage with all stakeholders when we develop and implement policy. So this conference gives us the opportunity to recognize the importance of trust explicitly, building trust and transformation, and placing it at the forefront of our collective efforts to create caring, resilient, and sustainable health systems across our European region. So it is in this spirit that I now hand over to our two keynote speakers for this plenary. We will first be hearing from John Clifton, the Chief Executive Officer of Gallup, who will share his extensive experience of measuring trust in a talk entitled Building Trust and the Other Global Warming. And here, he may be too modest. I will give a plug for his book, Blind Spot, The Global Rise of Unhappiness. I highly recommend it for teachers, researchers, but also for politicians, because I think it has some important messages, but I'm sure he will be available to talk about it later. And then we'll hear from Margaret Crook, Professor of Health Systems with the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health in the US, and someone that I've had the privilege to know for many years. Margaret will tell us about her latest research, which is available from today, which is looking at using the People's Voice survey and telling us what this says about trust. Now, John and Margaret will each speak for about 15 minutes, followed by a panel discussion during which we will hear the perspectives of Poppy Nicolaidou Canary, who is the Minister of Health from the Republic of Cyprus, and Tanis Montvila, the Vice President of the European Junior Doctors Association, Alan Nemarenko, the Minister of Health of Moldova, Timur Sultan Gaziev, the First Deputy Minister of Healthcare of Kazakhstan, Manuel Pizarro, Minister of Health of Portugal, and Bruce Aylward, the Assistant Director General for Universal Health Coverage and Life Course at WHO in Geneva. And co-moderating the panel discussion with me, if she will stand up at the end, is my colleague May van Schalvik, who, like me, is a London-based public health doctor and researcher at the London School of Hygiene and Tropical Medicine. John, will you please take the floor?
Thank you, Martin. Thank you for, that was the kindest endorsement I've had for that book ever, so thank you for that. I just want to land 2 points today. One is what we would humbly offer as another factor in trust, and the other is one of the most concerning trends that we've ever seen in the history of Gallup's database, which I believe is something that, if the factor that I'm about to mention contributes to leadership and overall perceptions of trust, then we should be very concerned about this particular trend. So I think the reason we might be here is that many years ago, Gallup did a study. We did it under a very successful book called Strengths-Based Leadership. And what we'd studied was, what are the biggest needs of followers? We found there were 4. One was compassion, one was stability, and the other one was hope. But the 4th one, and again, the reason why I think maybe I was invited, was trust. In order for leadership to be successful, people need to feel like they can trust those particular leaders. And so, of course, then it turns on, well, how do we build that? You know, I'll just kind of give you 2 different definitions. One, in the policy brief, number 58, it opens with an incredible quote where, and I'll just kind of summarize, it says that every discipline, philosophy, and culture differs on this particular definition, which makes our jobs really tough if we're going to create trust, especially if we're going to create trust among so many different audiences. So, of course, naturally, I did what most of us would do today, and I turned to ChatGPT for an answer. And I said, can you tell me in the most conversational way, what does it mean to create trust? And I think it said something back to me like, make sure you deliver on what you promise and don't stab me in the back. Now, those are incredibly useful definitions, and they range everywhere from highly complex to maybe obvious or a little too conversational from what ChatGPT had suggested. But there's one other component that I'm not sure that we have, or if anyone has fully appreciated, it's this particular audience, and I think it's the reason that we're here. A few years ago, we started to experiment with a particular question. We would ask this among organizations. And the question went, does this organization care about your well-being, or do you feel like they care about you as a person? And again, we asked this within companies. Then we started to ask it for Americans about the company or organization in which they work. And we asked it on a 1 to 5 scale. And we found that over time, about 25% of people said, yeah, I think so. And what was remarkable is during the pandemic, it absolutely spiked. And it went up to almost half of all Americans that at the organizations in which they worked felt like the organization truly cared about their well-being. And why? Because they actually saw policies being implemented so that they felt safe coming into work. And they saw robust communication from their leaders saying, we care about you. We want to make sure that you're safe every day. But shortly thereafter, we saw a massive collapse, and it dropped all the way back down to 25%. In fact, at the time, a lot of people were talking about whether or not, in economic terms, interest rates were transitory. If transitory applied to anything, it might have been that leaders, or that people felt like the leaders within their organizations actually cared about their well-being. Now, if you said this to many executives, a lot of them might kind of push back, and they might say, come on, those are too soft of metrics. Why should I care about that? Because when you have someone in that kind of state of mind, we can statistically see that they are 70% more likely to not burn out. They are 70% more likely to not leave your organization. If you care about turnover, then care about whether or not they actually feel like you care about their well-being. And many businesses operate or function on this concept of whether or not the employees or customers will promote you as an organization. You can see that those who feel like their well-being is cared about, you see that they are 5 times more likely to recommend the organization in which they work if they feel that the organization cares about their well-being. That's how important that very concept is to the idea of trust. So what we did is we said, you know what? If this is working within organizations, we ought to try something else. Through our project known as the Gallup World Poll, where we conduct interviews in over 140 countries every single year, we decided to say, do you think that the country's government actually cares about you and your well-being? And we wanted to see what that actually looked like. Now, of course, one of the things that we've been asking for many decades, at least in the United States, we've done now across the world, is we also ask about trust in institutions, or I should say a proxy for trust, and it's not perfect, but confidence in institutions. So for example, how do you feel about the national government? How do you feel about the courts, the banks, the healthcare system? We've asked that now, and while we go to 140 countries, we can only ask those questions in 119. So what we wanted to see is there a statistical relationship between how people feel about if governments care about them and their well-being and how they feel about the overall performance of the institutions within their country? I only have 4 slides. Here's one of them. This is what that statistical relationship looks like. Now, this might be a bit of a logical leap, but you could go so far as to say that one of the big drivers about whether or not people have overall trust within institutions is whether or not they feel like the government cares about them and their well-being. Again, that's the exact text of the question. So while we are here searching for the right kind of factors and definitions that truly create trust, this may be, and again, we humbly offer it as another component that we should be considering in building trust throughout the entire world. Because while there are many differences, as the policy brief 58 opens with, there are also some things that we have in common, and this appears to be one of them. Now, the second point that I want to land is if well-being is a critical factor in creating trust, what is the well-being of the state of the world today? We've been doing this for almost 20 years now, but many people have called for this idea of if we're going to measure GDP and understand whether or not economies are growing or contracting, the other thing that we should do is understand whether or not well-being is growing or contracting. And of course, there have been many initiatives that have gone out to help make massive contributions to this, whether it was the Stiglitz Commission that was put together in France, whether it's the Better Life Index put together by OECD, or whether it's the World Happiness Report that Jeff Sachs, SDSN, and the United Nations puts together, and Gallup is a proud contributor to data within that effort and within the OECD Better Life Index. Because again, we want to know, just like when Simon Kuznets in the 1930s approached Congress and said, we ought to have a metric to see whether or not the economy is growing or contracting, we now today humbly offer a metric to see whether or not the world is getting angrier, or whether or not the world is getting sadder or more stressed. So we went out now, and as I mentioned, 140 countries. In 2/3 of the world, we're still doing face-to-face countries. For those of you that may not do survey research on a daily basis, this is what it actually looks like in order for us to try to ensure that everyone within a country has an equal chance of being selected. This is a sampling frame in Nigeria. We take every single territorial unit and break it up into equal proportions so that there's the same amount of people living within them. And then we actually conduct interviews with roughly 8 to 12 people in those physical territories. And then we interview 1,000 to 2,000 people per country and roughly 150,000 people per year. And most of them actually look like this. And you'll see in that handheld device, this allows us to do a number of quality checks to see if the interviewer actually went to the location in which we had asked them to attend. It also allows us to record audio. In fact, one time, one of our interviewers was over a lake for almost 2 hours. We were deeply concerned about his safety. What we found out later is he was actually fishing. And so we were able to take that out of our final data set. And then, of course, we have algorithms on the back end that help us understand quality as well. So if there are internal inconsistencies, for example, if somebody says that they are very, very rich, but they're also hungry, we know to flag that, to look into it, to see is there something that's challenging us with the overall quality of data. I give you that context because the next graph I want to show you is the graph that I'm deeply concerned about, as is everyone at Gallup. And it's something that we call the other global warming. Because as I mentioned, if you could create a measure just like GDP, but for stress, for anger, for sadness, for physical pain, or for worry, we attempted it. And as I mentioned, we've been doing it for almost 20 years. And the way that we ask it is we tell the person or ask them, can you just tell us about all day yesterday? And can you tell us if you felt a lot of each of the following? And then we ask them those negative emotions. And by the way, the responses are absolutely amazing. One woman that we had a conversation with in Vietnam, she paused and she just started to cry. And the interviewer said, well, are you okay? And she said, no one's ever asked me a question like that before. And these are the exact conversations that we're having, 150,000 of them over time. But when you aggregate the world's pain, the world's sadness, and the world's anger, this is what it looks like. And if that was unemployment and you had seen a 10% increase in unemployment, and the ILO reported that today's unemployment, the global unemployment figure at about 6%, was then 16%, imagine how many conferences and world leaders would be talking about that particular issue. But when it's humanity's anger, stress, and sadness, it almost goes totally unnoticed by leaders. And maybe it's because we can't put a number to it. But today, this is what it looks like. And now that we know about behavioral economics, now that we know about the rise of effectivism, that most of the decisions we make are not driven by our rational thought, but most of them are actually driven by our highly refined algorithms that we call our emotions. This means that of the roughly 30,000 to 40,000 decisions that we make every day, that was an estimate by the NIH, imagine how much worse the decisions are that we're making because of how we feel. So as I mentioned, if there is a contributor to building trust, which is people feeling that their well-being is truly cared about, this is our marker, and it's not going well, and we have a lot of work to do in order to get it fixed. Thank you so much for having me here and taking an interest in our work.
Thank you. That was great. Thank you, John. And I should say, as a researcher who does surveys as well, you should never underestimate the challenges of doing them. And particularly, I think it's getting more difficult in many countries as people are unwilling to open the door and people are working irregular hours and so on. So hats off to you and your colleagues for your achievements. Margaret, it's a great pleasure to welcome you to the lectern to tell us about your work on the people's voice.
Thank you so much, Martin. And good morning, everyone. What a great pleasure to be with you in this beautiful snow globe of a city. It's my first time in Estonia, and I'm deeply honored to be here. Before we get into data, I just want to tell you a little bit of the origin story of what I'm going to share with you today. In 2018, I had the great honor of chairing a Lancet Global Health Commission on high-quality health systems. You're very familiar with commissions, Lancet commissions, lots of commissions. The goal of our commission, together with commissioners from all around the world, was to take a fresh look at health system quality, this intangible but central essence of a health system. And our commissioners, who hailed from all over the world, came up with a definition of what is the job of the health system. So let me just propose this to you and see what you think. In 2018, we stated that a high-quality health system has just three jobs. The first, and of course this varies by context, this has to be contextualized, but what we maintained is that in every health system, the aspirations should look roughly like these three goals. The first is to deliver consistently care that maintains or improves health. And consistently was emphasized because every health system has bright spots, every health system has centers of excellence, but not every health system can provide that care day in and day out and to all of its citizens. So consistency is key. Number two, a high-quality health system is a system that generates trust. We said this in 2018. It's a health system that people value and respect. That's job number two. And job number three of a high-quality health system is to change when people's needs change, to be able to adapt. So to borrow a metaphor that Natasha told us about earlier, health systems are not piles of bricks. They are not buildings. They need to be mobile devices toward the achievement of health, bendable and adaptable. So those were the three goals of the health system. And our commission then looked to see, okay, if we agree this is what it's about, how are we knowing, how are we measuring our progress? And we found that there are tons of data. There's absolutely no shortage of health statistics. WHO Europe, WHO headquarters, and in all of the regions has been producing wonderful health statistics, which are incredibly informative. In fact, last night, a way to get past my jet lag, I went through and read some of the wonderful reports that you have been producing. And they are actually, to us, examples of how health systems should be assessed. And yet, in all of our assessment, we had a large team assessing all of the literature. We found major gaps in measurement as well. And those gaps pertained to some of the softer and squishier and more nuanced elements of health system performance. And in particular, one major constituency seemed to us to be missing from measurement, and that was the people. How often are we really getting information from the population? I would say to you that those suggestion boxes that you see in some clinics are boxes to which no one has the key. And if someone had the key, I'm not sure who would read it. And if someone read it, I'm not sure who would act on it. We may think we're doing better with some surveys, and I think we are making progress in some countries. Perhaps we're now over-surveying the population who visits a clinic just one time. But we're making small but important strides. But still, what was missing to us was an instrument that helped put people in the driver's seat. It asked the population, tell us about your experience in the health system. Tell us what you value about the health system, and also what is not working for you in the health system. And this instrument is the People's Voice Survey. So I'm proud to share with you some of the results from our survey. The effort took 3 years to put together with a global consortium. And also, I'm incredibly proud to be here with WHO Europe because, in fact, you are one of the main collaborators in the survey. You will see some data from Europe that was here as a result of this collaboration. So I couldn't be happier to be with you. Let's have a look a little bit at the People's Voice Survey. So the first point I want to make is that the survey intends to do something different than an exit survey or a satisfaction survey of patients. This survey is about accountability. It is our intent to measure the way the system is working for people. So I want to distinguish rhetoric of the health system from function of the health system. Here we are measuring function, the way it functions for users. So it's primarily an accountability tool. It's also intended to serve as an improvement input. And as you are implementing reforms, we hope the People's Voice Survey can be used to track evolving population sentiments about how that reform is going. The second point here is just that the survey was designed to be usable across all health systems. Now, of course, that's not just out of the box. There's an adaptation process that is required to make the survey usable, but we have demonstrated, and I will share with you, that it is usable in high-income countries like the United States and in countries like Ethiopia, with all the countries in between. And again, this takes a collaboration with our local partners to be able to make the survey meaningful. But what does this illustrate? One thing it illustrates to me is that we share aspirations across countries for what a good health system should do. The survey is primarily a phone and online survey. So phone surveys are now useful and applicable in the vast majority of countries. And in countries where mobile phone penetration is low, so below 80%, we've augmented those samples with in-person surveys as well. So we can capture the population that does not own a phone. But this is not a problem in a country as tech-enabled as Estonia, where I could get into my room with my phone. And in fact, I think the survey is usable across a wide variety of countries. Because it's a phone survey or an online panel, it also makes the survey cheaper and more flexible and more usable. And the last point I'll just make is that you see here a map of the countries that have implemented the PVS so far. We are right now collecting data in our 18th country, China. Today, December 12th, is the launch of our first series of papers that summarize the first wave of results of the People's Voice survey. They're available in Lancet Global Health. We hope to share that information with you so you can get much deeper than what I'm about to share with you now. All right, let's move to a key interest in the People's Voice survey, which is the notion of confidence in the health system. We've been talking about trust this whole day so far, and I think all throughout the day. The way I think about trust is that you don't get trust by asking for trust. You get trust by delivering what people want, what people value, what people see. And so the first element that we're measuring in the survey is this element of, do you feel secure in the health system? A key job, maybe the key job of a health system, is to help people feel health secure. This is something the UNDP and WHO have been promoting since the 90s and earlier. Do you feel secure? If you were to get sick tomorrow, can you get the care you need? And we added, importantly, and consistent with universal health coverage, can you afford that care? If you can find it, that's one thing, but can you afford it? So those two together, to us, are a measure of what we call health security. So that's one aspect of confidence. This is basically assessing, is the health system delivering for me? The second piece is putting the user as the judge of the health system, as one of the key constituencies to whom accountability is owed. And here we're now asking about endorsement. Do you support the health system as it is right now? Does it need major change or an entire overhaul or rebuild? That's one question. But we're also interested in movement of the health system, since, as we said, it is not a building or a pile of bricks. We're interested in seeing whether people are seeing a positive direction. So two aspects to endorsement. One is the system today, is it working well? But the second is, over the past 2 years, how has the system been working? So again, health security, is the system delivering? But also the ability of people to judge and assess and be giving us their endorsement. Those are the two elements. Let's come right to the data. So what you can see here is this first slide is showing the percentage of populations. So again, all adults. These are not health system users alone. These could be current users, or it could be future users. That's why it's very important to involve the whole population. Here we can see that across a range of countries, and some of the font is small, but you can see there are countries represented throughout the regions of the world, in Africa, Latin America, Asia, North America, and Europe. Approximately half the populations feel that they can get and afford both things. Good care if they were to be very sick tomorrow, okay? Now, I want to just focus on the European countries. Italy, 64%, UK, 49%, Greece, 21%. These results are extremely divergent throughout your region. And in fact, I'll just point out, since I'm from the US, one very notable thing in this particular question is that the UK scored 49%, lower than the United States, which does not have universal health coverage. So this tells us something quite important. I want to say that for almost all countries, the affordability element was rated as worse than the accessibility element, meaning more people said, yes, I can get it, than people who said, yes, I can afford it. And then lastly, what we know for sure as we analyze country by country by country, we've been very lucky to have colleagues in a number of these countries who can help us understand these findings, is that clearly, as Martin has pointed out, people's assessment is influenced by local context. I'll just give you the example of Peru, which scores very poorly here, which has had a succession of ministers of health and huge political turmoil, and the health system is left wavering, and people perceive that, and Peru gets some of the worst ratings here on this indicator. So, health security, that's job number one of the health system. Are we providing it? And let's turn to endorsement. So the first, the lavender color, is the direction of the health system. In the past 2 years, do you feel the health system is improving, staying the same, or getting worse? We're showing here the percentage of people who say improving. On the right-hand side, we're asking, is the system working well today, yes or no? And that's the number of people who say yes. So, again, let's focus in on the European countries. The bottom line is, if you look at the right side, very few people overall in your region are satisfied that the health system is working well. It maybe needs only minor changes, okay? I want to share with you the results for Italy is 31%, UK 15%, and Greece 11%. I don't know if we have any Greek colleagues here, but I've certainly learned and worked with our colleagues in Greece. And in fact, here, I just want to give a big shout out to Dr. Joao Breda. I'm not sure if he's in the audience today, but the Greek WHO office on quality has been a huge contributor and partner in this. And I think this information has been fed directly back to the Ministry of Health of Greece for consideration and for action. Second point is on direction of travel. That's the lavender or purple bars to the left. And you can see that this survey was done in the past 1 year. And therefore, when we ask about the previous 2 years, we're talking about the COVID period, right? So here you can see how many countries think that the health system is improving over COVID, all right? And I want to just draw your attention to the worst performer in the entire survey, and that is the United Kingdom, right? In which I think it's 5%, I'm having trouble reading from here, felt that the system has been improving over the last 2 years. So you can also see that those two measures give us different pictures, right? The current system versus the movement of the system. And I think they're really complementary to help us understand the population sentiments. All right, so of course you're asking, what is influencing these kinds of results? And the conceptual theory that we've drawn on, based on the work of many scholars, and here I want to really thank Professor McKee, who's one of the early innovators in this space and really intellectual forces in this whole space of comparison of health systems, but also in measurement of such complex concepts, measuring such concepts in post-Soviet Europe, for example, for many years. So based on Martin's work, based on the work of other scholars, we've identified 3 key drivers. They have to do with the quality of the health system. What are you delivering to the population? That's going to influence confidence, of course. The goods, remember? Second, it's clear that people's own features, their demographic characteristics, their level of health, their optimism also influence their assessment. And last, political and social context. So important. COVID, it's not the fault of the health system. Systems have to respond to it. The political upheavals in countries all affect these outcomes. So we think that all 3 of these factors affect both the security and the confidence and the endorsement. Let's see how much. So I want to share with you that quality of the public health system, another question in the People's Voice survey, increased confidence in the health system by 4 to 5%. If you thought that your public health system performed at a high level, you are 5 times more likely to feel confident. And the other point, which is a central aspect of our entire meeting here, is the notion of, is anybody listening? We had a question in the survey that said the government is responsive to my opinion about the health system. The government's listening to what I say about the health system. When people felt that, the confidence level went up 3 to 7 times, depending on which indicator we were looking at and which country we were looking at. In fact, I would say that this is one of the surprising, as a researcher, you have hypotheses, but when you look at the data, in a good experiment or in a good study, you're often surprised. And here was my surprise. The degree to which responsiveness was associated with confidence was very, very high. It's one of the most powerful indicators. Lastly, let's just think a little bit about who is feeling this way. It's not enough to look at the population as a whole. We need to understand what's happening underneath and within subgroups. And what we can see is that health security, the feeling that you can get and afford good care, was higher among educated respondents and among health system users. Okay? People who are more familiar and people who are more educated felt more confident that they could get that care. Who didn't feel confident is people with low income, women, people with chronic diseases, and people who had, in the past year, experienced an unmet need. They were not secure. And then in terms of endorsement, what was, I think, really striking to us and should be a cause for alarm, I would say, is the people who did not endorse the health system, who did not feel it was working well today, tended to be younger people, people with, who were educated and urban, so people actually who are likely future taxpayers of our health system, unhappy with the system today, and people who had unmet needs. So we need to think about what the implications of this are. And with this, I just want to direct you to our full series with all of the information in our academic papers launched in Lancet Global Health today on Universal Health Coverage Day. No better day than for us to reflect how to measure universal health coverage than by including the people. Thank you so much.
Thank you. So thank you very much indeed, Margaret, and a sobering message there. And also just, I might mention, what we wrote about in the Pan-European Commission on Health and Sustainable Development. When you get people feeling left behind, of course, that creates fertile ground for populist politics, which has been so corrosive in many countries and with such worrying consequences. I'd now like to introduce my co-moderator, Mevan Skulvik, who will start us off on the panel discussion.
I'll stay at this end so we get a bit of balance so we're not so silent down this end. Thank you very much, Martin. I actually wanted to begin by building on the two excellent keynote talks we've just heard that very much focused on measuring trust, by starting with a question to Minister Sultan Gaziev, where, because particularly in Kazakhstan, we see that there's research into trust specifically into health professionals among different groups. And in particular, this reveals some interesting findings in that we often see there's increased trust expressed amongst those who actually have a family member as having greater trust in health professionals. And I specifically wanted to ask whether this type of research and these findings are useful to you as a minister, and any reflections that you have on the reasons behind some of these differences between different groups.
Thank you very much. Thank you for the question. First, please allow me to greet all of you and thank the government of Estonia and the WHO European Regional Office on the behalf of the Ministry of Health of Kazakhstan for this productive collaboration, this conversation. Thank you for inviting me to attend this important conference devoted to the 15th anniversary of Tallinn Charter. Kazakhstan reaffirms its commitment to the principle of justice, solidarity, and public involvement expressed in the Tallinn Charter. The mission of the healthcare system is to create conditions necessary for the prevention, preservation, strengthening, and the support of the health of all citizens. This means that the foundation of any activity is establishing relationship of trust both inside and outside of the system. Understanding between the governing structures, the direct providers of the healthcare services, and the population, the patients, is crucial in this situation. The significance of political will in implementing a line of improvement in the healthcare cannot be overstated. There should be trust in all fronts. Significant progress has been made in Kazakhstan for the last several years toward the system reform, including the reaching key benchmarks like population coverage through the screening and preventive care, creating conditions for identifying social determinants of health, and setting up efficient patient care structures. In the meantime, we openly admit that there's still unresolved challenges in the healthcare system, including the staff shortages, retention of healthcare professionals, as well as the shift toward the person-centered technologies. Moreover, we openly discuss the potential challenges, such as climate change and environmental risks, which may result in additional demands for the medical services. What grounds people's trust in the healthcare system? A person's trust in the healthcare system grows when they see that they're getting adequate healthcare services, adequate attention, that their needs are being acknowledged, and that the good conditions or necessary conditions are being established. Since the independence of Kazakhstan has made progress providing universal health services over the past 20 years, we have been conducting targeted efforts to prevent diseases and promote healthy lifestyle in society, especially in the rural areas, since we are the 9th largest country in the world with only 20 million population and almost half of them living at the rural areas. We just started the Rural Healthcare Modernization Project that sets the priority to provide necessary healthcare at the rural areas. So another huge priority for us is to advance the institution of multidisciplinary teams. The very nature of team requires members to collaborate in a trustworthy environment in which tasks and responsibilities are successfully assigned to and accepted by all team members. The teams focus on the meeting of each person's needs for the physical, social, and mental well-being is what unites them. And we already see that the approach continues to reduce in the hospitalization rate, decreasing 4.5% annually. Social workers and the psychologists operate both in primary healthcare organization and the hospital level. And we implemented so-called patient support services to get the feedback from the patient. As well as we established wellness centers for elderly to support their leisure times under supervision of qualified specialists. As for the youth, we keep an eye on their health, especially one of main concerns are their mental health and reproductive health. So we established more than 200 youth centers around the country. So the provision of any assistance is fundamentally impossible without a trust. A system built on a trust represents a continuously improving cycle, which each participant contributes to the process.
Okay, thank you very much.
Thank you very much.
A lot is going on in Kazakhstan. So I'm now going to ask a question to two of our ministers, because both of your countries have faced quite considerable challenges. And these are questions to Moldova and Cyprus, because we're talking about trust in the health system, but as we all know, it's difficult to disentangle it from trust in state institutions more generally. And both of your countries, and we had earlier hoped to have an Icelandic minister as well who faced a similar challenge, have experienced major banking crises that created a serious loss of trust. And these were in 2012, 2013 in Cyprus, 2014 in Moldova. And I wonder if you could maybe, starting with Moldova, tell us about what insight, and briefly because of course the time limitations, what insights did this give you into public trust and how you recover public trust whenever you face a really almost existential challenge like that? Please. Hala.
Okay, thank you for the question. I think our banking crisis in Moldova was a little different, so it caused was caused not by financial crisis, but by the fact that the money of the population from the state bank was stolen by oligarch people connected with politicians. So the trust of the people in the government, in the politician, was totally killed. So it took 8 years for new wave of politicians, very young, to rebuild the trust in the country. And now we have a majority of pro-European party. It's even not a coalition. It's one party that is keeping 63 places from 101 in the parliament. So, and you know our story about association to European Union countries. And I think that for this slogan, trust and transformation, I would consider that we need to add another one, invest. On the trust, it's losing, it's killing. We have to invest a lot, to invest in people, in emotions, in trainings, and at that time, of course, it was killed also the trust in the health system after the pandemic situation came, and it was very worse. So we have to rebuild, but it's not possible with investments. If we'll have a link with the health system, it's very important to rebuild the trust with investments in people, in emotions, in training, in equipment, in infrastructure, in professional development. Because without all of this, there is not possible to have the development of the country, and there is not possible to have a democratic course of the country. So we are depending a lot of our politicians, not only about their declaration, our financing also depends, especially in the health system, of the decision of politicians. And we can tell, after my colleague from Cyprus will tell their story, I can tell you a little what we are doing to rebuild the trust of our health workers and patients in Moldova.
Well, and we will come back to that. And of course, when we were here in 2018, the theme of the Tallinn conference then was include, invest, and innovate. So we're very much taking that on. And of course, your president a few months ago was invited to lunch with the FT. I don't know if people read the weekend lunch with the Financial Times. And it was a fascinating read. I commend it to everybody. So how does that relate to your experience in Cyprus? Because you've also had a challenge.
Thank you very much for giving us the floor to express our views on these very important issues, trust and transformation. First of all, let me also thank the government of Estonia, especially the Ministry of Health, as well as the regional office of WHO for this wonderful event. And let us start with the challenges that Cyprus faced. As we all know, in 2013, Cyprus suffered a banking stroke, and that influenced a lot of issues that are related also to the development of a new health system. But with great effort, we managed to establish a new general health system in 2019, covering the outpatient sector, and in 2020, we covered the inpatient sector. Now, the challenges we face is that although we brought international experts that were called to study the Cyprus situation and come up with proposals that would be feasible for the design of this new healthcare system, there was certain mistrust, especially from the private insurance people. Yeah. And as expected, of course. But also we had mistrust from the healthcare providers, which stemmed from the resistance to change. And why resistance? Because when you push forward changes, if you do not do it on a bottom-up approach, and you don't involve stakeholders from the beginning, then this provides resistance to changes. Further to that, the resistance from the healthcare providers gained a momentum also because of the political ambivalence. So this led to a situation where both clinical and operational issues were not considered in depth when the system was introduced, and that made difficulties for leaving out guidelines, protocols, and safety nets in the health system, which we encountered after a year or two. And this is what now we are targeting for these guidelines and protocols, but also legislation to cover these gaps. On the other hand, we had also the citizens that were worried about the transformation, about these changes, and they were not convinced that this new health system would meet their needs adequately, and this would end up in an additional tax also, without the expected returns through transparency, through accountability, shared vision, and values.
So one of the challenges that Cyprus, maybe it's a challenge, maybe it's an opportunity, is that you've got an enormous diaspora. I live in North London, and there is a very large Cypriot community, fortunately, providing us with all our fruit and vegetable shops, for example.
And not only.
And therefore, the quality of our food improves. And many of those people move back and forward.
Yeah.
Strong family connections. And so they have experience of the Cypriot system, they have experience of other European systems. How does that impact on trust in any way? Does that shape their views?
The people living in London, because they come often, as you well said, they somehow they start comparing the two systems, and they are giving more trust to the Cyprus system rather than the NHS. I'm sorry to say,
which I think Margaret has been sharing with us. That why?
The NHS system was actually the model that we copied as Cyprus, but we are now strengthening our system, while UK is seeing a lot of erosion in the NHS due to financial constraints, due to Brexit, due to many, many reasons, of course, and lack of nurses, lack of doctors, and all that. Why? Because our new system is being strengthened in many ways. They are seeing it a lot more flexible and a lot more valued by the patients now. And if I can just give you some reflection or through numbers that gives the reality, our population is just a little bit less than 900,000. And from the figures that I have here in front of me, 806,000 beneficiaries have visited their personal doctors. And almost 700,000 have received medicines. And 500,000 people have undergone laboratory tests. So it means that people have started to respect and value, but still, I believe that there is lack of emotion, humanitarian approach to the patient. I think there is a lot of space there to build on this kind of trust, because trust is not gained. The trust can be gained. Yeah. It is gained through delivery. It's gained through accountability. Yeah. And this is what we have to work on.
Sure. Thank you very much. And we said we would come back to this point. Moldova has had a great migration of health workers to other countries. So what are you doing to restore the trust, to bring them back, to keep them?
First of all, do the factors that I already said about. So we had a very high level of migration in the country, from about 3.5 millions of people, more than 1 million migrated. So among them, we can imagine how many health professionals have been. So many of them migrated to Romania, to France, to Italy, and to other countries. And we conducted some years ago, in the frame of the project with WHO, we conducted some studies about migration of health professionals in Moldova. So you should know that first push factors in the line from Moldovan doctors were the development of the country and political aspects. So this is the main factors that are pushing people to leave their houses, country. So next were working conditions, and after that, salaries. So now that I told, we have to invest, and we are doing this. We are investing in the infrastructure, so installing equipment, creating, for example, a network of patients with stroke, national network, also ensuring with the equipment. We took all the hospitals from local authorities because they were in the very bad conditions, so we took them under the Ministry of Health. We'll improve their situation, and maybe after we'll remove them back. So we are investing in training of people, even in training abroad, to send them to take knowledge. We are investing, increasing salaries, also paying indemnities, paying incentives. So all these factors together will convince our people, because as politicians we have to demonstrate that the things are changing, the world is changing. So even I received emails from our colleagues that are working in Romania or in France, and they are asking if they will have such of equipment. They are ready to return. So we can convince just with example and being courageous to do changes.
So include, invest, innovate to take us back to 2018. Manuel, you're from Portugal, and you're in the very fortunate position of having a very high level of trust of the public in many ways. And we saw that with the COVID vaccination program, where you had a very high uptake. So how did you do that? Because I'm sure lots of people here want to know the secret of your success.
Well, it's my pleasure to be here, and I will try to share some ideas about that. It's true, in Portugal, vaccination is always a success. I think it has a lot of reasons. There is not a single point to explain that. First of all, there is a huge, strong alliance between policymakers, government, and health professionals, and the scientific community, and with sound scientific knowledge about that, and a lot of involvement of the community leaders, participation, transparency. We have, and of course, the second point is that we have an efficient system, a robust, efficient system to deliver the vaccination. This also contributes to people trust on the system, because they see that it works, it's easy for people, it's accessible, it's easier to manage. And finally, we must combine the robust traditional system with innovation. For instance, we had a lot of changes during pandemic, and during vaccination in pandemic. We put vaccination out of the National Health Service, and we put that in the community with the centers of vaccination organized with local authorities. Now we were quite concerned in this new season how we can adapt again the system, and we create a new system which combines the national health systems, health centers, with the community pharmacies. We involve all the Portuguese community pharmacies in the vaccination, and I can share with you 75% of people with 65 years or more have already vaccinated to influenza in this season. So we are getting again a huge success on that.
Fantastic. So with that, I'm going to hand over to May.
Brilliant. And sticking with the theme of COVID-19, actually, I wanted to ask you, Dr. Elwood, on reflecting on your experiences on working in health crises, what do you think the importance of loss of trust was during COVID-19 pandemic?
Thank you, May. Actually, the minister just talked about the pandemic, and everybody here lived through the pandemic and are going to have their own perspective. So I'm going to pick another infectious hazard crisis to talk a little bit about, and that is the Ebola crisis in West Africa that many of you are aware of about 8 years ago now. So when I was asked by the Secretary General to lead the response there, if you think back to that time, there was rioting on the streets of Liberia. There was a food blockade in Sierra Leone. We had food for 4 months, or 4 weeks, pardon me, at that point. And when I arrived in Guinea, they had just murdered about half a dozen of the people who were trying to manage the response. So we had a very grave situation with the escalating Ebola crisis there. And if I thought back, to the question, I remember 18 months afterward, when we'd finally slowed down this crisis, a reporter asked me, she said, what was the most important thing you needed when you arrived there in West Africa to stop that, help stop that Ebola crisis? And at that time, people were thinking, well, you had all the resources of the UN. We had planes, and we had helicopters, we had World Food Program and UNICEF with us. We had a new experimental vaccine that had just come out, and people were very much focused on these things. And when I thought back, I thought, no, the single thing that we needed was trust. And it was completely destroyed. The communities had no trust. The health workers had no trust that they would be safe. The politicians had no trust that this thing could actually be stopped. And trust was absolutely crucial in any crisis like that, because you need the cases to trust that you know what you're doing, so they will come forward and you can stop transmission, and save their lives usually, and they don't infect others. You need contacts to come forward so that they can be quarantined and we can stop chains of transmission, similar to what we were doing in the pandemic. And you also need the health workers to trust that they are not going to get infected, that you know how to take care of them. And this was a very difficult situation, because not only did you need trust to be able to manage that response, it was a very complicated response. It was an unknown disease happening in a new way in urban centers, and there was also constantly changing information as we tried to figure out what to do. And worst of all, the experts like myself who had arrived, people had no experience with and no trust in us as well. So a very difficult situation. And ultimately, the control of Ebola, frankly, was not a medical response or a health response. It was a trust-building exercise. And Martin, you talked about trust comes in on a tortoise and leaves on a horse. And that's what it was. It came in on a tortoise that took 18 months to build the confidence in the communities to participate in the response, because you need the communities basically to lead the response. But we learned a lot about what to do well. And I think we applied some of that in the pandemic. You have to understand your populations. You've got to completely engage them and co-create the response with them. You can't quarantine people if they're not involved in how that is going to look. You have got to deliver, as I think, Margaret, you mentioned, you have to do it consistently and competently if you want to maintain that trust. And you've got to maintain that engagement, and you've got to be transparent throughout it. And as we mentioned, consistent. So back to the start, I think your question, May, was how important is trust? Absolutely crucial. And it's very hard to build in a crisis. You have to build it in peacetime. And that's why the discussion here about trust and transformation of systems is so valuable, not just in strengthening your systems, but in building the resilience you're going to need in a crisis, because you will really depend on it. Primary healthcare approach, absolutely crucial. It involves the communities at its heart, social participation. These are the things you're going to rely on in a crisis.
Yeah. Thank you. And it really stresses the importance of pandemic preparedness needing to actually integrate trust as well, not just equipment, numbers, and other measures. So, Martin, over to you to
Okay,
ask
so
Hannes.
Antanas, you represent Europe's junior doctors. And I think it's fair to say that relations between the medical profession and politicians, I declare an interest because, as you know, I was president of the British Medical Association until July. The relationships have not always been good. And sometimes there's been perhaps a loss of trust. But I'm wondering, are there any countries in Europe where there is a trusted relationship? And second question, after listening to these distinguished health ministers, are you more convinced that that the medical profession should be trusting them? They've come along to talk about this, to engage, and we've heard how important they see it. Have they convinced you?
So thank you for the question, and also thank you for having us here representing medical professionals during the meeting with the high-level politicians. And I think it's very nice to see that WHO and other partners recognizing the need for medical professionals also and to get involved in solving these problems. And I think, to be honest, we don't have hard data on trust, and I think this is also what we learned, that we can definitely explore our countries and to see and evaluate whether they trust. But of course, we speak with each other, and we know that there are some countries that they trust and work closer to their ministries of health
we have countries that struggle more. And I think this is also important to understand that it's related to the political cycles, because even for those countries that we knew that 2 years ago been closely working with with the governments addressing their problems, in the next 2 years they suddenly get distance because the culture changes, the politician changes, and I think John outlined perfectly that there are cultures or organizations that are built on trust, built on collaboration and respect for their employees. Is the same with politicians as well. These are thriving. Those who not care for their employees, for their workforce, these struggling. So I think it's more like a general problem. It's not something that we can have, only as an example that one country is something uniquely more trusted and other is not. And I think it's also important to look into what erodes the trust, because we all knew and know through the event that trust is only through building and through collaboration and transparency. But what erodes, and I'm not talking here about that we still have countries and politicians that try to show doctors as somebody who needs more money and use them as a kind of their political inner fighting. So I'm not even taking out for that, because this is something that's unacceptable. But we also believe that some of the mistrust that's currently growing is also related to the lack of efficient policies or implementation of these policies, which is heavily related to the medical workforce issues that we currently talking more and more, because especially with COVID pandemic or even the financial crisis that we had immense pressure on the healthcare workers, and we believe that this trust is kind of, the medical professionals feel not kind of taken care of, and the biggest concern for us is that the trust, we see that it needs to be, also comes with respect and being cared of. And we sometimes feel that the previous systems heavily relied on the trust between medical professional and patient and their personal responsibility to deliver care. And now the younger generation, as we see, not only in a patient side, but in a doctor side, say that we are not feeling responsible for failing system. Why should we stay there? And that's when we don't feel it, and if we don't feel being trusted and cared, we just leave. And this is the biggest concern for us. And just to finalize, I think as an organization, we also kind of, and doctors, we also feel and understand that trust goes both ways. We don't want to only ask. We also, as a medical professionals and association, especially representing these who are there for change, for better care, we feel our own responsibility to get into discussions in meetings with the politicians and to help them, make tangible decisions. And just to finalize on what we learned, just very quickly, I think I'll be writing down the countries who are signing the outcome, because if we will get all these things implemented, I think we are good here to go. So I think more or less I will just share what's being done, and I think we will be there for to oversee and to check whether countries actually trying to implement these.
So a really important message there, that if you are a minister of health and you need health workers, you come on one of our panels and you persuade them to come to your countries to work. So that is great. And I think one of the things we do know for certain is that the health workforce will be high on the agenda for both the European Commission and for WHO going forward. And just a quick shout out to the work of Thomas Zapata from WHO and his team, who have done some really amazing work on that. Over to you, May.
Okay, and I just wanted to come over and pose a final question to our wonderful keynote speakers. So it's John and Margaret. I just wanted to ask quickly, because in the interest of time, if you have any last reflections on some of the perspectives and answers that we've had from the great panel here.
Please.
Let's go ahead. Well, thank you very much, May, and thank you, Martin. I think it was you last night who said, Martin, that some academics like to write papers and other academics like to see impact. And I like both of those things. And today, listening to these health ministers, to senior leadership in the WHO, it's incredibly energizing to hear these ideas, and also the deep appreciation that health systems going forward have to pay attention to more than the construction, the inputs, the bricks, as we said, and much more to Natasha's mortar. And I think, sitting in a university in the ivory tower, I think sometimes you fail to appreciate the evolution of some of this understanding. And so sitting here on the stage has been absolutely fabulous to hear from these ministers appreciating the challenges, because I think, on a stage like this, it's easy to gloss over, but I'm impressed by the fact you're clearly and very honestly acknowledging the challenges, but also appreciating the importance of investing in people, in delivering the goods, and trust will follow.
Thank you, John.
In listening to everyone's remarks, I was trying to think about the commonalities. And I think if there was one, it might be you might call it the 3 L's of leadership, which is listen, listen, and then listen. And what I mean by that is, and this is perhaps a place where all of us, but especially me, have huge opportunities. It's because oftentimes, based on an individual's rich expertise or their own assumptions, they stop listening. And I'll give you an example of when it happened to me. Is I was doing an interview in Mongolia, and I was sitting with a young woman. It was being translated, and one of the questions that we ask everywhere is because we want to understand climates of fear, but we asked her, in this community, do you feel safe walking alone at night? And in Mongolian, she looked back at the woman and she said, no. So I thought I was engaging in good listening, because at that moment I thought, well, she doesn't feel safe. So if somebody doesn't feel safe in their city or their community, what causes that? At that moment, I thought, surely she must be afraid of crime. At the very end of the interview, the woman, who is, I believe, a great listener, looked at the young woman and she said, you said you don't feel safe. Why? And she said back to her, because I'm afraid of the rabid dogs in my community. But my problem is that if had I been advising leaders in that community, I would have said, you got to increase funding for police. You got to make sure that there's proper lighting. I would have gone through an entire analysis to figure out how can we make it so that she is safe from crime. It's not what she was afraid of. She needed a solution to rabid dogs. That's what bothered her the most. And it's because I stopped listening. And so again, I think if we're going to build trust, it's not just about understanding or listening. It's also getting to the root of the core problems, and that only exists by those 3 L's of leadership, which is listen, listen, and then listen more.
Thanks, John. And I'd like to thank everyone for your really open and honest answers, which is really key to trust as well.
Now,
Hand over to you, Martin.
thank you very much indeed. And many of you I know have been looking at your phones because you have been tweeting or Xing or whatever it is now, or using Blue Sky or Threads or something about the gems that you have been hearing. But we want you to keep your phone out. And can we get the Slido up, please? Because we have a few questions for you. So if everybody could get their mobile phones up, and do we have a slide? I've been pressing. There we are. So what we would like you to do is to scan the QR code. I'm sure you all know how to use Slidos by now. Scan the QR code, and we have a few questions for you because we want to collect some information about our audience. We want to know what you think about a number of things. And so if you could just scan those, and if you could answer the questions, and we'll just give you a few minutes to do that. And while you're doing that, and somebody at the back will tell me when we're getting results in, please, if you could shout or wave. And can I just say thank you very much indeed. I have to say, John, if you didn't already have a very good job paid, I suspect far more than we could afford, it would be great to have you on our research team, because it is exactly that sort of the example you gave in Mongolia of trying to understand what lies behind these things. In our surveys, we ask about fear of crime and related to health and so on. But it is, we need to understand the lived reality. And I think so often we fail to do that. And again, Margaret, with your work, I think trying to understand how people see things, and it does make a difference. I'll be talking a bit more about the evidence that it makes a difference later. But I think what's been really good is that we have had a number of ministers with us here who have actually been emphasizing the importance of trust. They take it seriously. And I'm afraid not everybody does. Not everybody in politics does take it seriously, but here we have a number that have done that. And it's not just a recruiting drive for health workers to come and work in your countries, although hopefully there will be some who will be watching online and will be inspired and looking for jobs in Portugal or Cyprus or Kazakhstan or Moldova. But it is incredibly important in securing the future of the health systems. So here we are. What do we find? We're hearing that if we ask that hospitals should report to the public the types of complaints they have received and how they've responded, 80%. So that's pretty clear. Politicians who make statements they know to be false and do not correct them later should resign. That's only 70%. I wonder who were the 30% who disagree with that. We do have, does anybody know how many politicians we have in the audience? So, or political advisors. So that's not such so good. Health organizations should report publicly on any gender gaps in pay. Now, of course, the reason we ask that is that if they are discriminating on grounds of pay or race or ethnicity or something like that, then that is going to undermine trust. And maybe health workers who we know are leaving the health professions in large numbers, maybe they won't want to work in places like that. So I'm surprised that that is as low as it is. Why would we not want to know if we are paying, and it usually is paying women less? Surely we would want to know that and ask, why is that the case? But obviously, just over half of you think that. So I guess looking at the gender balance in the audience, well, maybe that has something to do with it. Doctors found to have demanded informal payments from patients should be removed from the medical register. We know that informal payments are widespread in many countries in the European region. I and colleagues have done a lot of research on that. That's been clear for a long time. These are very difficult to eradicate, very difficult to do anything about. But people do not quite take it seriously, so maybe that's a bit disappointing. Something to reflect about. So this was just to get an idea of how this audience, which is engaged in the health sector, think about all of these things. No right or wrong answers. These are matters of public opinion, and maybe we should have got either of you to help us design the surveys. Maybe we didn't ask the questions right, but I just would like to say thank you for participating in this. And with that, lunch, I think, but you can tell us, May, will...
Definitely. So thank you so much, everyone, for taking part in this first plenary, and really warm welcome again to our wonderful panelists. So we had, what rooms do we need? I need the names of the rooms to get this right. That's okay. So we have a closed lunch for invitation only, and that's downstairs in the small hall, I believe. And then there's a lunch for everyone who's not part of the closed lunch in... I need to get the name right.
Okay, but thank you again to all of our speakers, panelists, and to all of you. Thank you very much.
Thank you. Thank you.